Hey everybody, and welcome back to my channel for this Monday morning, afternoon or evening across the world where you may be at. And today I want to talk about some volunteer training that I just did for my local hospital with my local learning disability liaison nurse, Roger Blake. I am sure he won't mind his name being put out. I've been doing training with him on and off now. Gosh, must be going on 9-10 years at least. So today I did a very brief session on my living my life with autism and giving them some hints and tips and advice about how to communicate with autistic people. And the health professionals were very understanding, very respectful, and I got asked a few different questions, which was nice because it's always nice to be asked some questions to get me thinking off the top of my head and to get me thinking about how to respond in the most appropriate and respectful and polite and dignified way that I can to try and help them. And Roger has been a long time friend, colleague of mine for a very long time. I'm very gracious and very humbled that he still chooses to have me on his team calls when he chooses to do the training, and which happens each month now, at the end of the month I think it is. So I'll be doing these trainings at the end of every month going forward. I know I've not done a few for a while, so I did one today. I'm really proud of the result. I'm really proud of how it went. And I think, it is important, like you mentioned, to talk about how to communicate with different people who are either learning disability or autistic and their experiences in and around the hospital environment, and also outside of the hospital environment once they are ready to go home. And I think sometimes there can be a miscommunication between the patient and the clinician, and I think sometimes that can cause a lot of things being said and done that don't need to be said or done within the situation. And, I think with my own personal example, like I shared on the phone call, last year I was in hospital with a stomach infection, and I also had constipation, but that wasn't picked up till when I was admitted early hours the next day, when I'd been in on the Friday afternoon with the complaint, and it ended up not being picked up till middle of the day on the Saturday, and after all these numerous tests and things. And he was saying it's important to always check communication with the patient, because the patient always usually has some form of record of communication the way they like to be communicated with, which is essential for people like me who are autistic and have heightened senses to noise and heightened senses to being in an unfamiliar environment. So that is important. I do back him up when he says about make sure you have the appropriate communication, the appropriate people to care for that person with them, and to always make sure you speak up on their health and access to their care and what happens within the treatment and how long they expect to be in the hospital environment and what happens once they get discharged out of the hospital environment, because again that doesn't really get communicated well as much as it should be doing. And so I thought that was a really important point to pick up. And again, a lot of autistic and people with learning disabilities don't often have straightforward communication issues. We do have issues with speech, or issues with being in shutdowns, or issues with being nervous or anxious, which then can cause communication complications, which isn't entirely our own fault, but again it can cause communication difficulties with knowing how to care for us, how to proceed forward with care, and how to look after us if we ever happen to end up being back in the hospital environment, or if something happens to us that we need accident emergency, or we need to be admitted to hospital as a precaution for something else. So that's important to me. And being a autistic neurodivergent person, I'm not the most straightforward person to talk to. I know I have communication issues. I know I have issues with my eye contacts that can play another rather difficult situation, because my eye contact can be saying one thing and I can be saying something else. My body language, again, is another thing you have to look out for. A lot of patients with autism or learning disabilities may have issues with their body contact or their body communication. We may be wanting and saying one thing on the outside, but on the inside we're saying something else which is stuck, that we can't actively communicate to you. So again, that can cause intense problems. So again, that is something else to look out for if you are admitting someone with either a learning disability or a autism spectrum condition. I will not use the word autism spectrum disorder because I don't think it's relevant or important. Autism spectrum condition is the way that we choose to identify it, because it's a condition. It's how we look after ourselves. It's how we choose to be identified. It's how we choose to be interacted with. So please respect that. That is another thing that I will mention about language. Language is key and crucial to an effective, successful communication with patients who may be in dire distress, in pain that they can't actively always tell you about. Like for me, when I'm in pain, I am heightened. I am really heightened to the point where I'm screaming, yelling, really like in pain because I can't cope with being in pain. I hate pain of any shape, size or form, whether it's a simple toothache or whether it's a simple bellyache or whether it's back pain or whether it's something so small that can turn into so minor so quickly. And people go, oh Jem, what's wrong with you? You're absolutely fine. I'm like, really? Like, I'm not fine. Like, when I'm in pain, I am in pain. Like, you will know about it. I am in pain. Like, I don't have a very good pain tolerance. Not at all. My pain tolerance is rubbish. Real rubbish. And so, again, that's what to look out for. When Roger did mention it earlier on our discussion, pain is a really hard thing to communicate with, especially if you're a patient with autism, because some of us have a really high tolerance, which means you won't notice it that we're in pain, that we're sick. But some of us, like myself, who have a very, 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 very low tolerance for pain, you will notice it, whether it's a simple cut on our hands, or whether it's a simple broken hand or broken wrist or broken leg, broken foot. You will know about the pain because we will not be tolerating it. Our behaviour may change, so it may be a case of we become aggressive, or we may become agitated more, or we may become more highly anxious, or we may be more severely distressed than what we would be on a usual day-to-day functioning level. We may be more irritable when it comes to food, or food tolerance, or pain medication tolerance. We may want more and more and more pain medication rather than having less pain medication. So again, it can be the differences between balancing what is right to do to the patient for the patient, at the same time helping the patient to succeed and do well whilst they're in the hospital environment. Being in hospital is not an easy thing. When I was in hospital being very, very ill, I did not cope. I was a pain in the backside. I was very, very shouting to my dad, and I want to come home. I don't want to be stuck in there. I don't want to be here. You can't leave me here. I was very, very up and down yo-yo my behaviour. I was in such dire pain. So again, that can cause communication problems and make your parents, carers feel upset if they are with you. So that is something else to look out for. Also, like, our behaviour, like maybe aggression wise, can change, or we become more heightened, like anxious, or want to, be a bit disruptive. And again, that can cause problems for clinicians who are trying to treat us, who are trying to help us, who are trying to support us. So again, that is important to take that into consideration when you are admitting someone to the ward or to a day clinic or to an outpatient setting. It can be really frustrating having to be moved from one area to another, to another, to another, to another, because again, we don't know what's happening. So again, you have to effectively communicate with each patient on each area of their medical care, whether that's they're moving wards, or they're getting more medication given to them, or how long they're going to be in hospital. Make sure you update them if they're staying 1 day, 2 days, 3 days, 4 days, a week, a month. Like, you need to be on top of that and say, right, this is what's happening. This is what we're going to do to go after you. This is going to be your named clinician. This is going to be your named nurse. This is going to be your named HCA or whatever staff member you may be facing. Make sure that you are actively telling the patient what is happening, when it's happening, and what they expect whilst they're in the hospital surroundings. Food can be another issue. I was really bad in my food in hospital. It was a case of my dad having to bring food in for me because the food simply just was not up to my tolerance. I could not stomach the smell of the food. It was making me gag, making me retch, making me feel sick. So then again, my dad was having to go outside of the hospital premises to purchase me food to bring into the hospital ward, so at least he knew either I was eating something that I enjoyed and that was tasty to me. So again, take that into consideration. Also, food can be a tolerance. Drinks, again, can be another tolerance issue. It can be whether they like water or not like water, like squash or not like squash, or if they ask for drinks to be brought into them in the hospital environment, because again, obviously we are limited on what we can have in hospital due to medications and such. So again, you have to bear that in mind as well. And one of the nurses brought up earlier about the noise situation. Again, you have to take into consideration if you have a patient with learning dis, or a patient who has autism spectrum condition, or maybe have a case of both, or a case of a learning disability, autism and a mental health issue, noises are going to trigger them. It's as simple as that. Noises are going to be a simple trigger that are really are quite harsh in hospitals. I know we can't always avoid it, I know that. But again, if, like earlier it was said, if you can move a patient who has high noise tolerances into a side room, if a side room is available in a ward, then please do that, because that will lessen the anxiety and the noise. Also, it will lessen any anxiety they've got or stress they're going through, because again, being in hospital, it can be quite stressful. So yeah, I hope you've enjoyed this little video. Please like, comment, share and subscribe. I would really appreciate it, and I will see you all soon. Bye.